1 second. Dr. Fine, if you could unmute yourself one more time. Sorry about that. There we go. So I've now had the pleasure of introducing you for about a year now, as you've given us these updates and provided us with all kinds of information. And so for this night, I wanted to do something different when I introduce you. I think hopefully it's engaging. It'll put a smile on people's faces. It's a little irreverent because we're getting ready for Purim, sort of trying to bring in that theme. So here we go. It's my pleasure to introduce our speaker for this evening, Dr. Michael Fine, who's a member of our community, as well as a community health activist. Now, usually the bio that I read for Dr. Fine is something that he provided for me, but I wanted to do my own research because I started thinking, what if none of it's true? What if this is all made up and he's giving us all this information, but he's not an expert in this? So I did my own research, and here's what I discovered. So I present to you my data of who is Dr. Fine. Let's see here. All right, so this is how we advertise it. So far, so good. Yes? Give me a thumbs up. So I said, who is Dr. Fine? And here's what I've learned about you. You love speaking behind podiums. It's one of your passions. You also love being on television and being interviewed for advice on healthcare issues. But here's what I've really learned about you, Dr. Fine. What you love more than anything, you love giving people immunizations. Exhibit A, Exhibit B, and Exhibit C. And so what I've learned in my research is that if you ever stand still for more than a minute, you know what you can expect? Dr. Fine's going to give you some kind of injection of some sort.
Assuming we have it to give.
Correct. You will be more than happy to provide people with these different shots. I hope you a little bit of levity to begin tonight's conversation. Thank you for being here, as always, to answer questions regarding the coronavirus that are so specific to here in Rhode Island, to provide a sense of comfort, enable us to plan for the future, and also just bring us together so we can learn more about the virus. So what I'll do is I'll start by giving you the floor. If you, I put the latest information from the Data Hub up. You don't have to go over the specific numbers, but if you could interpret us, what do these numbers mean? Are they good things, bad things? And then you can tell us what you want us to know, and then we'll ask you questions. As always, we'll invite people. As always, we'll invite people to put questions in the chat, and I will help moderate that conversation. How does that sound, Dr. Fine?
It sounds perfect.
All right, and 1, and 2, and 3. Take it away.
So the news is in Rhode Island is pretty good, and in the nation is pretty good. Sorry.
Good night, everybody. Thank you very much. That we're good.
Yeah. In the nation, we are slowing with the transmission of the disease. We're down to about half the number of new cases that we had 4 weeks ago. Unfortunately, we still have too many deaths. We will likely cross 500,000 deaths sometime in the next 10 days. But the rate has slowed, and that's a very good thing. The same thing is true in the state. We still have way too many new cases, but maybe a third of where we were 4 or 5 weeks ago. And the number of people in the hospital is less than half. Still too many deaths. We've had more than 200, almost 2,300 deaths so far in Rhode Island, which is more than we want. The good news is that we now have about 90,000 people immunized, and have given about 127,000 total doses altogether. That's about 9% of the population, and we'd rather be immunizing people than not. We are, to a certain degree, in a race against time, in that some of the new variants, the variant from the United Kingdom, the one from Brazil, and the one from South Africa, certainly the United Kingdom variant, and I believe the Brazilian variant has been shown to be here. Not so sure about the South African. In the United States, but they spread more quickly. And so there is fear among epidemiologists that in somewhere between 4 and 9 weeks, they will become predominant and will spread rapidly. And that means that the quicker we can get the population vaccinated, the slower, we'll be able to slow things down if we can get enough people vaccinated. Not quite clear that we will be able to get people vaccinated that fast because of vaccine supply and organization more than anything else. But we have seen in Central Falls a substantial fall off in the number of cases in the last week after only about 35% of the population was vaccinated. So all that's hopeful. Vaccination doses are now being made available through CVS and Walgreens, which is better than having them restricted to only a few places. The state is moving ahead, vaccinating people over 75, and I would hope we should be able to get people over 75 done in 2 or 3 weeks. And then, sorry, we'll turn to people over 65. And what I hope is that we will really be able to get people vaccinated with much more intensity in April and May when lots of vaccine supply becomes available. My biggest worry for April, May, and June, particularly June and July, is that by that time, many of the people who want to be vaccinated will be vaccinated, will have plenty of supply, and the challenge is to get to 90% of the population vaccinated, because when we do, we get something that Morty Miller suggests we call community immunity or population immunity. Others call herd immunity, and that stops the spread of the vaccine. So that's about where we're at. I think what's evolving is a sense that COVID-19 is going to be with us for a while, that we may stop this pandemic sometime in the next 6 to 9 months, but we expect to still see outbreaks from time to time, and we will see whether people need just the initial vaccination series or need boosters. I think there's a sense that we're probably going to need boosting. We don't know how often, and we don't know how we will keep track of new variants that come up. It is really important to stop the transmission of the vaccine, in my view, and I think in the view of others. The transmission of the virus, I'm sorry. Because when there's lots of virus spreading around, that's exactly the conditions under which new variants evolve. And so we're best off trying to get this virus, to very low transmission, if we possibly can. That's going to take really hard work. And I think that's work that we have not as a nation yet really committed ourselves to, but I'm hoping we will in the next couple of months. The one thing I want to make clear is that though we're down to a third or maybe even a quarter of the vaccine transmission at the time we were most infected, the Department of Health's projections suggest that every day about 20,000 Rhode Islanders are infected with COVID-19. And our level of infection would have caused most countries to shut down to prevent further transmission. The United States is kind of an outlier, and we don't want to do that. So we still have plenty of disease and are at risk for a recurrence of spread if we sort of loosen up, if we stop wearing masks, or if we start opening restaurants more, or start having more people gathering together. That said, the other thing to think about is that as people become vaccinated, those people will kind of enter a different world. And we all need to be thinking about how they can have different choices once vaccinated. There's probably some more opportunity for people to move around. The one thing we have to be careful about is, while we know that the vaccine prevents uh, moderate and severe disease and hospitalization and death, we don't know that it prevents infection and think it doesn't. And there's a real concern that even people who are vaccinated will be able to get the virus and transmit it, which means we have to be extra careful until everybody is vaccinated. So,
So a couple of questions. First, what is the process for someone who wants, if you're 75 or older, how do you apply to receive a vaccine?
um, I believe it's different in every different city. And I can't tell you that there's a single easy, place to call at the moment. I think most cities are asking people to call their city hall. Most cities are getting small allotments of the vaccine every week and will have their, I mean, they are not having their own clinics yet, I don't believe. There are, I believe, 5 central sites where people are being signed up, but they're being signed up at their city halls, as far as I know, um, for these vaccines at central sites. Now, I'm pretty sure that CVS and Walgreens will have their own sign-up process. Fortunately or unfortunately, this whole thing seems to depend a huge amount on computers. And so one of the challenges is going to be for people who are not completely computer excited to get through and get registered, because sometimes the registration processes and programs themselves can be somewhat difficult.
So everyone should consult their local municipality to figure out, or possibly be in touch with the PCP, I imagine,
I'm sorry, I didn't follow.
or check with their PCP, or consult their local municipality.
Check with the municipality, or check with a nearby CVS or Walgreens. I think there are going to be only a small number of CVS and Walgreens that are doing the vaccine, but I bet you will find on the CVS website directions. Primary care physicians are actually not very much involved at this moment, as far as I know.
So some people have started to ask. They've been able to register and get their first vaccine, their second vaccine, and they're looking at the calendar, and they're wondering, what are the implications for Passover? When can people start seeing grandkids once they get the double vaccine and they've waited the requisite 2 more weeks following the second vaccine?
So that's an important point. One is not considered completely vaccinated until 2 weeks after the second vaccine. So about 6 weeks after your first shot. Um, I don't, there are not yet recommendations about how people who have been vaccinated ought to and can behave. So I think common sense stuff is valuable. I think it is reasonable to spend time, with your grandchildren, somewhat socially distanced and masked when you're not eating, once you've been vaccinated. I would tend to keep the number of people in the room on the small side. So family units, not seders of 30 people this year. But I think if you're fully vaccinated, I think you can think about being with family.
Can you only be with family members who are also vaccinated, or can it be older? If you're 65 or older or 75 or older, you could be with other people in your family or pod, provided everyone's feeling well and they're masked, and you are masked as well.
I think it's going to be a case by case decision. So being masked in your pod is helpful. But if your family is only people under 50, then I think you can be a little more comfortable. If your family are people who are over 50 but not yet vaccinated, I think those people should maintain the discipline that we've got, remembering that this virus is still in wide circulation.
So I'm going to reiterate it in a slightly different way, if that's okay.
Sure.
If give all of these givens, given that it is usually not as dangerous for younger people as it is for people over 65, over 75, and assuming that the older members of the family are vaccinated and they have received their second dose, and it's been 2 weeks since then, presumably they can hang out, ideally outdoors, of course, but they could maybe be indoors with everyone masked, maybe with the windows open, not for days at a time, but for it does not feel irresponsible or reckless to engage in that behavior.
That's correct. And that I'll say that pending advice on this issue or guidance on this issue from CDC or the State Department of Health, that has not been issued yet, to my knowledge. I checked with a colleague at the State Department of Health at the end of last week, and there was no guidance yet. But there may be some, and when it comes out, then obviously we will be paying attention to what that guidance is.
A CDC study just came out today saying that I think double masks, wearing a disposable surgical mask with a cloth mask on top, I think they quoted it at 92% effective. Should people start wearing double masks all the time? What are your thoughts on that study?
Well, and this is a case where more is always better. The one place I'll say this is that double masking is still not as good as an N95. So an N95 gives you 5% protection. The double masking gives you about 92. So, I think one or the other, if you can possibly do it, if you're with other people. I don't think it's as big a deal if you're going for a walk by yourself outside and you want to just protect others. I'm not convinced that double masking is really necessary for that. But if you're in a room with other people who are not part of your pod or your usual household contacts, I think I would.
Recognizing that the amount of virus in the community has gone down from where we were about a month ago, have you started going to the supermarket again, or are you still having all your deliveries done by DoorDash or any one of those options?
We are still we are still having things delivered. We actually found it to be a very big time saver. So,
so is that for health reasons or just convenience now?
but we're beginning to talk about whether we're going to go into stores again. One of us is fully vaccinated, and one of us has had a single vaccine. So my guess is as soon as the second one has had the second vaccine, we may start to move around just a little more.
I appreciate the way you keep things anonymous because of HIPAA. Very nice. So, can you talk about when do you think, and obviously this is a part of a lot of components to it, when might be a realistic expectation that we could have programs in shul again?
Well, I think a lot depends, to a certain degree, it depends on whether we want to consider people who are vaccinated differently from people who are not vaccinated. My advocacy will be to ask everyone who comes to an event that you will be vaccinated. And that's more for their own protection than anybody else. Once more people get vaccinated. But about 10% of the population is vaccinated now. And I think we can start thinking about events for vaccinated people fairly soon. I think that by April, I expect 30% of the population to be vaccinated. And then it will be, a more interesting discussion. And I also am not convinced that when I say that everybody should be vaccinated, I think everyone over 50 should be vaccinated. I don't think we need to hold out for people who are under 50 as long as people are masked and social distanced.
Richard Middleman asks, should I take Tylenol before or after the second shot? It seems many people are feeling sick after they get their second vaccination.
And I don't think there's any harm in doing so. I take it a few minutes before. But I haven't seen recommendations one way or the other.
Ronnie Sirota asks, once vaccinations are open to people 65 to 74, will seniors with conditions identified by the health department that put people at a higher risk to be hospitalized, for example, chemotherapy, will those people be prioritized over the other 65s, or is it one big 65 to 74 group?
I think it's going to be one big 65 to 74 group. I think it's all going to be one group all at once. There are, in terms of numbers, there are about 70,000, maybe it's 80,000 Rhode Islanders who are over 75, and I think another 100,000 who are 65 to 75. So the numbers are actually decently large. We're getting vaccine at a rate of about 16,000 doses a week, though I don't think I yet understand how the doses coming to CVS and Walmart are impacting that. So it's kind of just math, figuring out how long it's going to take to get everybody up to date.
Can you shed some light as to why we don't have here in Rhode Island some kind of central sign up to get vaccinations?
I can't.
You
I,
can or can't?
I cannot. I am not privy to that decision.
Do you have an opinion as to how it should be done or no?
Well, I have thought having a central registration was a good idea for a long time. But I don't know what the technical or financial reason that it hasn't happened yet. Um, and I'm not convinced it's going to happen. I haven't seen movement in that direction. But I mean this, and I say this with some frequency that COVID-19 is the great revealer, and what it has shown us yet one more time is that we don't have a healthcare system in the United States. Israel, I haven't looked lately. When I last looked, I think Israel was 60 to 70% vaccinated already. And that's because there's a Ministry of Health and 4 HMOs, and everybody has to be signed up to an HMO. So there's somebody responsible for making sure that everybody gets vaccine. We have nothing like that in the United States. We are so far back that there's no way that I know to get CMS, the people who run Medicare, who know everybody over 65. You would think that they could just give the list to the State Department of Health and, have the State Department of Health call everybody up. But that doesn't happen in the United States. And, there are firewalls and roadblocks to prevent that from happening. And, if it were me, we as a nation should take a long look at this and figure out whether there's not some better way to do this, remembering that our healthcare is the most expensive in the world by a factor of 2, and our health outcomes are poor, and we totally failed with this really just cold virus. We totally failed to manage it, and I think that's completely a function of the fact we don't have a healthcare system and the fact that we're so divided as a people.
If one wanted to learn more about healthcare innovation and the ideas of a healthcare community provocateur, where could they read about these kind of things, Dr. Fine?
I have a book called Healthcare Revolt, which details all this in exquisite and boring detail, and another book called The Nature of Health, which does similar sorts of things.
Available on Amazon.com. Is there a time? Is there a timeline for when one should get their other vaccines, whether it's shingles, a flu shot? Should you delay getting your flu shot so you could get the COVID vaccine if you haven't gotten one already?
Well, hopefully by this time you've had a flu shot. Flu shots you should have had a month ago. The rule of thumb is that you shouldn't be vaccinated against COVID for 2 weeks after your last vaccine. So, if you haven't had a vaccine, if you haven't had a COVID vaccine yet, and you're 65 to 75, I think it's okay to get one of those shots tomorrow, but probably not in 2 weeks, because we don't know when the 65 to 75 will come up. when the vaccination for 65 to 75 will actually start. And we do know that, interestingly, flu is not circulating very much at all this year, likely because of the social distancing and masking. So flu is a relatively small risk. COVID is a relatively larger risk. And so one wants to work to prevent COVID before one thinks about preventing the flu.
Do you anticipate moving forward in the next 2, 3, 4 years, flu during winter months, masking will just become second nature for many of us?
I think it's going to evolve over time. So I think we will see outbreaks of COVID. I think we will see targeted vaccination for and sort of redo of vaccination for places where we get an outbreak of COVID, and we will probably see some, intermittent shutdowns in those places. Um, that's my guess. The rest, I think, is unpredictable. I think we may end up with boosters once or twice a year for COVID for the next 3 or 4 years. And then I expect to see those taper off as the human species gets accustomed to COVID itself and develops a community level immunity to it. But I think that will take 3 to 5 years.
Would you feel comfortable wearing a mask, maybe wearing two masks and going for a walk at the mall or before the stores open or after the stores open, just looking for warm places to go for walks?
Yeah, I think I would. I mean, I don't like them all, but if you do, good for you. I don't see, if there are not many people there, um, and you double masked, I don't see that it's a big issue.
Why is it certain states have, my parents, for example, in Florida, were able to get COVID vaccines and they're not over 75, and family members who live in New York have been able to get vaccines in New York. Why different in Rhode Island? Is there anything we could do to advocate so that we can get more, or is it just a matter of just waiting?
Well, I mean, it goes back to the fact we don't have a healthcare system in the United States that tries to do the same thing for everybody, which is the central problem. Essentially, who is going to get vaccinated first? The prioritization was left to the states, and different states did it differently. Every state has about the same level of supply. Different states have dished it out different ways.
Do we think will the creation of more vaccines um, will the creation of different varieties of vaccines increase how quickly we can roll everything out? Are we just increasing production of the two vaccines that we have now? Is it just building more facilities so we can produce more vaccine?
I think it's all of the above. So we're working hard to produce more of the two that we have now. We should have a third in 2 weeks. It's probably not as good as the first two in terms of efficacy. And everybody's who's making, all vaccine manufacturers are going to start making as much as they can once it's approved. Many have started producing it before it's even approved, in the expectation that it will get approved. And again, what I expect is, we will see a slow increase in the availability of doses over February and March, an explosion in April and May. And then my guess is we're going to be awash with vaccine and have not enough people willing to take it, which is going to be a very interesting and difficult discussion we all need to have as part of communities.
Can you talk about if you've already had COVID? Should you still be as can you still pursue getting a vaccine? Should you still pursue getting a vaccine, or is having a case of COVID or positive COVID test, do you still need the vaccine?
So I'm going to talk out of both sides of my mouth.
Excellent.
The current recommendation is that people who have had COVID wait 2 weeks and then get vaccinated. That said, there's also some discussion that if you've had COVID within the last 90 days and you are in a community that has not enough vaccine, you could put off your vaccination for about 90 days until other people who may be more at risk get vaccinated. There's not good science here. So I think it's pretty much a personal choice, but I'm pretty sure that that the recommendation is for every single person to be vaccinated eventually, whether you have had COVID or not. And
And
that's because the current belief is that the immunity that comes from the vaccine is more long lasting and more robust than the immunity that comes from having the disease.
it seems, Donna Gallagher writes, it seems like the next phase, 65 and older, is going to start before all the 75-year-old plus people have been vaccinated. This means that there might be people who are 75 years or older who might have to wait to get the vaccine because presumably the next demographic is already beginning to get immunized. What can be done so that older people can still be prioritized?
I think the most important thing is for older people to, or their families, really work hard to get them vaccinated soon, before the second wave, before the 65-year-olds, sort of march right in.
So
Uh,
given the choice of the Johnson and Johnson vaccine or the Moderna Pfizer one, would you prioritize the Moderna Pfizer one over the Johnson and Johnson?
yeah, and particularly for people over 65. Um, though there's a proviso in that. Remember, Moderna and Pfizer both use a new technology. It hasn't been as well tested as the technology of the other vaccines. Now, there's no evidence that the new technology has any problems. So, you know, at the moment, the Moderna and Pfizer have been shown to be more effective, and that argues in their favor. Um, and we'll see what happens with Johnson and Johnson. I'm betting that there's going to be a Johnson and Johnson booster before too long. So it's being released. We believe it hasn't been released yet, but it's likely to be released as a one-shot vaccine. But
Mm.
many of us suspect it's going to turn into a 2 or even 3-shot vaccine over time.
Once you get your first shot, if you take the Moderna or the Pfizer, does it matter the time between the injections, or is it?
Well, it's a different time. So Pfizer is 3 weeks between injection. Moderna is 4 weeks. Most people think it's unwise to shrink the interval, but most people also think that it's probably okay to extend the interval at least out to 6 or 8 weeks. 6 weeks is what I think people are saying you can likely extend it to. So if you've got to travel, for example, and can't be there at your scheduled 3 or 4 week visit, waiting an extra week is not a problem.
So if I can, again, if you have any more questions, first of all, these were all great questions. If you have anything else, please put it in the chat box. If I could summarize, or it sounds like what you're saying, right? In an ideal world, it would be wonderful if there was a centralized database where everyone could sign up and you wait your turn and everyone's prioritized based on their current health situation, their age, and it's very equitable with how we are all able to get our vaccinations. The truth is, the vaccine currently, there is limited supply, and accessing it privileges people who are able to navigate technology, have computers, sign up for all of these services, and get the vaccines. It sounds like what you're suggesting right now, if everyone's asking or thinking, what should I do? It's number one, research to figure out when, so that you are fully ready to sign up to get the vaccine when it's available. Register older members in your family at all the different locations so you can get the vaccine as quickly as possible. Still be vigilant about wearing masks, socially distant, not taking your mask off in front of other people who don't live with you, washing your hands, being cautious. Continue that. And then, God willing, as more vaccine becomes available, more older people will be getting vaccinated. And so will increase our ability to be near each other, still distant, but it will feel remarkably different being in each other's living rooms as opposed to sitting in each other's porches.
And that's exactly right. I think the one thing I'd add is it's worthwhile for us all to pay attention to the extent to which the virus is circulating in our own community. So we know from the data from today that that Rhode Island now has, I believe, and it's not right in front of me, something like 250 or 260 new cases per 100,000 per day. That is clearly better than we were, but it is nowhere near where we need to be before we can think that it's safe to move around.
So
But as that number drops, and as I hope and pray that it does, there will come a time when we can say it's safer, but the safety is a function of how much disease is in circulation.
and if I remember correctly, you had mentioned that ideally, what would be your ideal number where things would feel like, I think you had said last time you had opened up too early. Are we talking 30 cases per 100,000
I think we're talking 14 or 15 cases per 100,000 per week, or about 2 cases per 100,000 per day.
to really, so it's not smoldering, it's done, right? You can, all right, it looks like we have two more questions and I think we'll wrap it up for the night. After you get the vaccine, how long does the mRNA linger in the human cells?
We don't know for sure, but it's supposed to be gone fairly quickly. Again, this is new technology, and we will see studies over the next number of months, but everything I've read suggests it's gone very quickly within a week or two, I believe.
And have we learned, we've spent a lot of time talking about vaccines, so from a preventative perspective, have we learned about new therapies or new treatment options? Have we become better at taking care of patients who do have COVID and have severe symptoms?
We actually have become much better. And the case fatality rate in hospitals has dropped. We've begun to use infusion therapy, and Rhode Island has kind of done better at this than most places, which means that for people who are at risk, people over 65 and people with medical problems, if they develop symptoms of COVID, they should and can call their primary care doctor, and their primary care doctor can refer them to one of a number of infusion sites where you get by injection what are called monoclonal antibodies. That's actually what Mr. Trump got when he was president, what Chris Christie got, and it does really seem to be effective in reducing the severity of the disease. That is widely available in Rhode Island. I believe we've used it more than 1,300 times already, and is likely helping reduce our hospitalization rate. It's really a good thing if you, as I said, if you're not vaccinated, if you're over 65 or have other medical problems and come down with symptoms of COVID, call your doctor right away and let's get you infusion therapy and hopefully make it so that you don't get anywhere near the hospital because we've essentially stopped the progress of the disease.
So it feels like sometimes when we finish these conversations, we hang up the phone or we close the Zoom room, and you might think to yourself like, oh my gosh, when is this going to end? It feels like, I don't know if there is obviously still a lot of disease and virus in the community. We still have to work on the vaccine rollout. We still have to be vigilant and take care of ourselves and our family members and our friends and the greater community and mask up and practice mutually, remind me the term you used, Dr. Fine, mutual safeguards to protect each other. But it also sounds like there is a trajectory towards a sense of normalcy, some sense of normalcy, or a return to being able to be in the presence of friends and family. Maybe 6 weeks to 2 months away, perhaps it will begin to start feeling a little bit different.
I think start. And as Dr. Phillips just observed, people do feel considerably different about the world once they're vaccinated. It sort of takes a weight off everyone's, that sense of impending dread kind of goes away. But that,
Could you imagine?
right, well, you know, those of us who don't otherwise carry the sense of impending dread, because that's who we are. Um, but uh, but I think we will see some beginning normalization in 2 or 3 months beginning, and then some movement toward that in the fall. One thing that's going to help this along is when we start getting vaccine and getting kids vaccinated as well. Kids aren't going to be vaccinated. We can't tell when kids are going to be vaccinated because the vaccine isn't approved for use in kids yet. I believe it's being tested in 12 to 18-year-olds as we speak. Um, and, but I think it's going to take 2 or 3 years to get to what looks like full normalization, but I think we'll get there.
I hope so as well. We'll invite you to have yourself, you should have a warm cup of tea so you can take care of yourself as well. As a reminder, if you want to get an update each day from Dr. Fine, where can they find you?
At Go Local Prov at 1:30 every day. Go Local Prov is something you get to on the computer.
So you could Google it. And will you be behind a podium when you speak there, or is that more of an interview
No,
style?
I'm sitting exactly where I'm sitting now.
Well, very good. I turned off the spotlight, so hopefully if you click gallery, you should be able to see all the folks who are assembled this evening. As always, thank you so much for taking this time with us to share your perspective and to let us know how to stay safe and how we can each do our part to take care of ourselves and take care of other people as well.
Well, thank you, and thanks everybody for paying attention and trying together to put this behind us.
So with that, we'll all do jazz hands for Dr. Fine so we can feel a little bit of the love there.
Thank you.
And feel free to unmute yourselves and wish each other a Lila Tov.
Thank you so much.
Thank
you so much.
Thank
Lila
you.
Tov.
Lila Tov.
Dr.
Nice
Fine.
job.
Yashikawa.
Yashiko.
Good job.
I'll be remiss if I don't say something.
you.
Don't forget to order your Mishloach Manot for Purim. It's coming up. And we'll see you tomorrow morning at 8 a.m. for Zman Kodesh. Lila Tov, everyone.
Lila Tov. You, Michael. Come out. Okay.
Oh, she can't see it. I can't see what she went on. Ronnie,
Yes, hi.
hi. I missed you today. You weren't at class for the
Wait, which-
Rabbi Laufer?
Oh, no. I actually did, today I had chemo.
Oh,
So
okay.
arranged to go, I'm not arranged to just go to the 7th